Today, we're talking about Periodontal. It's the only FDA-approved tooth and gum dental laser. Dennis Winson is a diplomat of the American Academy of Periodontology and is here to tell us more. Welcome, Dr. Winson.
Thank you.
So, a laser to work on our teeth. Tell us more about Periodontal.
Well, Periodontal was developed to treat periodontal disease. It's the only laser that has approval of the FDA, in which studies and human block sections have been submitted for approval.
Now, dental surgery is something that scares everyone, and dental gum disease especially scares everyone. I don't floss. I should. I'm sorry. But so I'm one of those people who's probably going to have to come to you. What is the normal treatment for gum disease?
Well, the traditional treatment, which has been done for many, many years, is basically where we anesthetize the gum tissue and we use a scalpel to reflect the gum tissue away from the teeth, and we clean out the infected tissue.
Oh my.
And then we suture it back up again.
So I should start flossing immediately. But it's probably too late. So tell me why Periodontal is a better option for dealing with gum disease.
Well, Periodontal operates on a different principle. It evaporates bacteria so that you don't have to reflect the gum tissue away from the teeth. You don't use a scalpel. You use the energy from the laser to evaporate the bacteria. So when you do this, and if there's less trauma to the tissue, therefore is less or no swelling, less or no pain.
Less or no pain?
Yes.
Great, so I shouldn't be scared about going to the dentist for this?
No, in fact, in the last almost 2 years, I've yet to prescribe a narcotic prescription. Great. Over-the-counter, Aleve, over-the-counter, ibuprofen, or sometimes patients don't take anything because they say they don't need it.
Wow, great. So what are the other uses for this laser?
Well, we can treat abscess ulcers, we can treat herpetic lesions, we can treat any type of bacterial infection.
This is a great way to use this laser. And why does this laser do so many wonderful new things? What makes it so special? What makes Periodontal so special?
The magic wavelength.
Okay.
The magic wavelength, the energy level is 1064. If you go above that energy level, you will char the tissue. Oof. If you go below the energy level of 1064, you won't kill all the bacteria. But 1064 is the magic energy level which accomplishes the eradication of bacteria without harming the tissue. The Periodontal has the ability to distinguish between healthy tissue and normal tissue. Therefore, you get less recession or less shrinkage of the gum tissue because it's less invasive.
Who's the target audience for this?
Anybody who has periodontal disease.
Okay. So this seems like a wonder laser that can do all these great things. How many doctors and dentists in the area actually work with the Periodontal?
I think there are 4 periodontists that now have the laser. We were one of the first ones to start treating patients with it.
How long have you been working with it?
It'll be close to 2 years in December.
Okay. And this is your go-to tool? Is this something that you really find is a miracle worker for your office?
This is the go-to tool. For the most part, in the last 2 years, I have not done conventional periodontal surgery.
Wow.
It's all been with the laser.
Is it faster with the laser? I mean, it sounds like you have to do, the scraping and the prepping.
It's faster with the laser. It's very interesting you brought that up. We have the ability to treat the entire mouth at one time if the patient wishes. Most of the time, we do a half a mouth 1 week apart.
Okay.
And that's fast. Now you're just waiting for healing to take place. But the actual treatment is done. Less visits, less time, it's done. And the patients, it's for the patients. We're not saying that the laser is superior to conventional therapy, but what we are saying to the patient it is. Less discomfort, less or no swelling, faster healing, takes the fear out of it.
Excellent. So first of all, I should start flossing. I can feel you telling me this. But what's the next step? If I'm worried about my gums and my health of my mouth, what should I do? Should I come to your office and get a full checkup?
It would be nice. That's the only way, really, is to examine and let you know where you are. Periodontal disease is not just the teeth and the mouth. Today we have a lot more information that it does affect the potential health of the rest of the body. It can affect heart attack, it can affect stroke, it can affect pancreatic cancer, it can affect diabetes. We're not saying cause and effect, all right, but there's a relationship. And obviously treating periodontal disease removes one factor.
Great, thank you so much, Dr. Winson, to tell us about the Periodontal and our health of our mouth. Thank you so much for joining us. More Let's Talk Live is coming up. Stick with us right here.